again to talk about prolotherapy and how it could be an option when it comes to treating your chronic pain, which we know a lot of people are suffering with, is Dr. Ross Hauser, a prolotherapist at Caring Medical Center. Good morning. Welcome back.
You too.
So this morning we're going to talk about bone marrow prolotherapy, which is just one of the options when we're talking about prolotherapy, but kind of remind people what it is that prolotherapy is able to help. You know, again, we talk about that chronic pain, which a lot of people are suffering with. They're frustrated.
Yeah, in general, we just say sports injuries, osteoarthritis, chronic pain. But prolotherapy can help meniscal tears, labral tears, rotator cuff tears, you know, even headaches, migraine headaches and stuff, because a lot of that is from the neck. But anybody who has a loose joint or a degenerated joint or degenerated tendon, ligament, meniscus, those kind of conditions can be helped by prolotherapy.
And you know, a lot of people, I think they're maybe, you know, looking at the cortisone shots again, or they're, you know, they're maybe just tired of you know, trying to put a Band-Aid on it, and they really want to get to the cause of what's going on. This is an option that may be able to help that get there.
Pain, Carly, generally means that a tissue is weakened. Like you can't run because there's something in your knee that hurts while running. It can't handle the force. So what the tissue needs is to be strengthened. So prolotherapy is a natural injection technique that stimulates tissues to get stronger. That's the key thing. We often say the tissues get repaired or prolotherapy restarts the healing process, but in easy to understand terms is prolotherapy strengthens tissue. Like you as an athlete, me as an athlete, we don't want to cover up pain. We actually want the tissue to get stronger. I mean, why do you work out? Why do you go for a run? Why do you lift weights? So the muscles get stronger.
And one of the ways is with this bone marrow prolotherapy, because there's like, you know, again, a couple different options for how the prolotherapy works. So explain what the bone, and I know some people when they hear bone marrow, they think, ouch, or, you know, it makes them a little nervous. So kind of explain what bone marrow prolotherapy is.
Yeah, bone marrow is basically where most of our immune system comes from, Carly. So imagine if we could take the immune cells, the reparative cells, and they're in a syringe, and you have a tissue that's not healing, like you have a meniscus tear, and you don't want to get surgery. We could take those bone marrow cells, and we could inject them right into the meniscus. And like this is a knee joint, and then this is like your shin bone. That's your shin bone right there. I would take some Novocaine. I would numb the outside of the bone. Me or Dr. Special, we both do it in the office. Then there's a really thin drill. We drill into that spot where we numbed it, goes into the bone marrow. We take out the syringes, however much bone marrow we need for the procedure. Then we're injecting it right into the structures that are weakened or damaged. And the bone marrow will start a healing cascade. And that healing cascade can stimulate repair of cartilage, for instance, for up to 6 months. They've shown in repeat MRIs that the cartilage volume continues to improve for up to 6 months. So imagine.
And you've done a lot of research on this and really kind of tracked and making sure that you get, again, this is not for everybody, but making sure that you get the right candidates that you think, okay, we do think this is going to be able to help.
Yeah, if anybody wondered about research, I'd say go to caringmedical.com or prolotherapy.org. And one of our studies, Carly, was published last year in the Open Arthritis Journal, where we documented with 24 cases end-stage arthritis. 16 of the patients, the orthopedic surgeon had already said they needed surgery. But again, we qualified them that they were good prolotherapy candidates. And the study showed that the people who got the bone marrow prolotherapy had statistically significant improvements in pain, and also a decrease in pain with exercise. So we got them back to exercising, and none of the patients at the end of the study needed surgery.
Well, as we close here, again, I love that you're honest where you say, hey, look at our research, look at our website. I love that you even say, hey, we put the prices online, because I know Medicare, this is not covered by Medicare, but you still like to make it affordable for people and know what they're getting into, right?
No, exactly. And, you know, we do want athletes and people with arthritis to know there is options, affordable options. And so we, like you said, everything's on our website. Go to caringmedical.com. And the other thing, too, is we have thousands of people on our Facebook page, because over the last 23 or 25 years that Dr. Special and I have been treating people with prolotherapy, and we've gotten them back to their activity levels. They're on that site, so you could actually ask former
Word of mouth
clients.
is a powerful thing, and I love that you're so open about that and saying, hey, go meet the people that have tried this, hear their stories.
Yeah.
So, well, again, as we close, what is the best thing to do if you want to find out if you are a candidate? Maybe somebody is facing surgery here in the near future.
It's always good to do a consultation in our Fort Myers office, but people are on Facebook and they're on Google. Go to caringmedical.com. We have all the different kinds of conditions on the site, and you could actually see the procedure. Go to YouTube, type in my name, prolotherapy, and you could actually watch the procedure.
I love it. You guys are like an open book.
Oh,
You're trying to be very honest and letting people know what to expect. So thank you so much. We love when you're here. We look forward to having you back. Thank you, Doctor.
Carly. Thank you so much.
And for more